Good morning, Philippines. Welcome to the Workers Channel. Today, we are here to discuss the privilege that we can avail from our social welfare benefits. With that, we have here personnel that are workers or CEOs from social welfare benefits who can assist us in this area. But before that, let us watch this video clip for today's scenario.
Okay sir, asa man tani unahon ka? Ang ato mo iningon diri man dapita. Yalapos ta diri. Guys, ngani atong buhaton. Gikan diri sa switch ato lang drapan og tulog dinga kawayra 1 meter extension para ka makabutaw sa mga switch. Then subayon na tani diri dinhi sa pagid main musakata ng posting, musakata ng kahoy para sa over the building para makabutang ta drop sa ER. Okay? Kana mo na panuwa. Butangan ng sa wire. Isa ka pala ganyan, property supply. Agay! Kasakit sa tol!
Hello, I am Washington DINO Jr. I am an SSS member and a PhilHealth and PAG-IBIG contributor. What are the benefits and services that I can avail?
We are sorry for the accident. This time, we are joined with Mr. Dino to let us know how to avail these benefits that he can actually avail and help our fellow workers. With the help of our guest this morning, come and let's discuss the services and benefits that we can provide as workers. So here is Mr. Joseph Dennis ADLAWAN, CEO of PhilHealth Insurance Corporation, and from Social System CEO Ms. DELIA TIBON, and lastly from PAG-IBIG CEO Ms. CARINA LUMAAD. Good morning and welcome to the Workers Channel. Thank you for accepting our invitation, sharing your insights on this area. Now we lead back to the situation of Mr. Dino, who is also an SSS member, PhilHealth and PAG-IBIG contributor. Can we ask Mr. Dennis ADLAWAN, CEO of PhilHealth, to impart to us the benefits that he can avail?
Okay, good morning Mr. TIBON and good morning Mr. Dino. Okay, the government provides social welfare services through the different government agencies like the SSS, the Social Security System, the GSIS, the Government Service Insurance System, the HDMF or the Home Development Mutual Fund or the commonly known PAG-IBIG, and the last but not the least is the PhilHealth or the Philippine Health Insurance Corporation. Now, PhilHealth implements the National Health Insurance Program that aims to provide Filipinos with financial assistance and access to affordable health services. It covers hospital costs, subsidy for room and boarding, medicine, and including professional services for doctors. These benefits are actually paid to the accredited healthcare institutions through what we call case rates. The case rate amount shall be deducted by the HCI from the member's total bill, which shall include professional fees, attending physicians, prior to discharge. The case rate amount is inclusive of hospital charges and professional fees by the attending doctors. Who can avail of the services? Those members who have made 6 months contribution prior to hospitalizations. What do they need or what do you need for you to be able to actually enjoy the benefit? You need to have the documents needed would be the MDR or the medical member data record and a duly accomplished PhilHealth claim form. Now, aside from the inpatient services, there are also outpatient services that may be availed of under the PhilHealth. Okay, what are these? Number one, day surgeries. What are day surgeries? Day surgeries or ambulatory or outpatient surgeries are services that include elective, meaning non-emergencies, surgeries, or surgical procedures ranging from minor to major operations where the patient are safely sent home within the same day post-operatively. So, Payment for these procedures are made to all the accredited facility through all case rates, just like the inpatients. Okay. The case rate amount shall be deducted by the HCI from the member's total bill, which shall include professional fees of attending physicians prior to discharge. The case rate amount is inclusive of all hospital charges, professional fees, and the attending physicians. What are the other services? Number 2, radiotherapy. The case rate for radiotherapy using cobalt is 2,000 per session and 3,000 per session using linear accelerator. Includes radiation treatment, delivering using cobalt and linear accelerator. Claims for multiple sessions may be filed using one claim form for both inpatient and outpatient radiation therapy may be availed even as a second case. Now, this is a 45-day benefit limit. What does it mean? It means that one session is equivalent to 1 day deduction from the 45 days allowable per year. If the procedure is done during confinement, only the total number of confinement days shall be deducted. Another one is hemodialysis. The case rate for hemodialysis is 2,600 per session. It covers both inpatient and outpatient procedures, including emergency dialysis procedures for acute renal failure. Claims for multiple sessions may be filed using one claim form for both inpatient and outpatient hemodialysis. This will be availed even as a second rate, full case rate amount. Again, there is a 90-day benefit limit, meaning one session is equivalent to 1 day deduction from the 90-day allowable per year. If procedure is done during confinement, only the total number of confinement days shall be deducted. Another outpatient services is the outpatient blood transfusion. The case rate for transfusion of blood is 3,640, one or more units. This includes the drugs and medicines, X-ray, lab, and other operating room procedure expenses. It covers outpatient blood transfusion only. What are the other benefits? This one is the primary care benefit. This is another benefit in the outpatient department. Primary care benefit, or the PCB. Who can avail of the PCB? These are indigents, sponsored members, overseas worker programs, and the organized group. Where can you avail the PCB? You can avail this through accredited rural health units, accredited health centers, accredited government hospitals. What are the diseases included under PCB? Asthma, AGE or acute gastroenteritis with no or mild dehydration, upper respiratory tract infection or URTI, pneumonia with minimal and low risk, and the UTI or the urinary tract infection. What are the benefit inclusions? Okay, one is consultation. Number 2 is visual inspection with acetic acid. Number 3 is regular BP measurement, breastfeeding program education, periodic clinical examination, counseling for lifestyle modification, counseling for smoking cessation, body measurement, digital rectal examinations, complete blood count, urinalysis, fecalysis, sputum microscopies, fasting blood sugar, lipid profile, chest X-ray. Aside from those laboratory exams, there are several drugs and medicines that are included in the primary care benefits. So, example, corticosteroids, short-acting beta-2 antagonists, and there are a lot of things that include. So, I hope everything is clear to you now, the benefits and the packages that you will enjoy under the PhilHealth Insurance Corporation. So, thank you and good morning.
We are grateful for you, Mr. ADLAWAN. Today, thank you for your time with us. Now, let's hear to the CEO of SSS, Ms. DELIA TIBON.
Good morning. I'll be discussing to you the benefits of SSS, or Social Security System. Under the Republic Act number 8282, Social Security Law, or SSS, also known as the Social Security System, is a policy of the state to establish, develop, and promote sound, valuable, tax-exempt social security system suitable to the needs of the people throughout the Philippines. It shall promote social justice and provide meaningful protection to members and their beneficiaries against the hazard of disability, sickness, maternity, old age, death, and other contingencies resulting in the loss of income and financial burden. In a simple term, Social Security System is an insurance program mandated by the government to all income earners or workers in the Philippines. All income earning SS members are required to contribute monthly into the fund. The amount will depend on their salary bracket. In exchange for the said monthly contribution, members will enjoy insurance benefits. There are different types of SSS benefits, such as sickness benefits. Sickness benefits is a daily cash allowance paid to the number of days a member is unable to work due to sickness or injury. A member can be granted the benefits for a maximum of 120 days in one calendar year. The unused portion of the allowable 120 days cannot be carried forward and added to the next following year. Maternity benefits is a daily cash allowance granted to the female who is unable to work due to childbirth or miscarriage. A member is qualified to avail of these benefits if she has paid at least 3 monthly contributions within 12-month period immediately preceding the semester of her childbirth or miscarriage. Disability benefits is a cash benefits granted either as a monthly pension or lump sum amount to a member who becomes permanently disabled, either partially or totally. A qualified SSS members may file to claim partial disability benefits after suffering fracture, amputation of fingers, VITO, hand, foot, or arm, leg. Hearing loss is one or both ears or loss of eyesight in one eye. Retirement benefits is a cash benefits granted either as a monthly compensation or lump sum amount to a member who can no longer work due to old age. A member can be qualified to avail to these benefits if a member is 60 years old or at least he has paid 120 monthly contribution. And that is a cash benefits granted either as monthly compensation or lump sum amount to the beneficiaries of the deceased member. A funeral grant of 20,000 to whoever paid for the burial expenses of the deceased member. Salary loan. Salary loan is a cash loan granted to an employed currently paying self-employed or voluntary member. SSS members with at least 36 monthly contribution can borrow an amount equal to their 1 month salary up to 15,000. Those with at least 72 monthly contribution are entitled to 1 month's loan worth twice salary up to 30,000. Now that you are aware of the benefits of the SSS, you might take advantage of these benefits. Thank you. That's all.
Thank you for imparting us the knowledge on availing SSS benefits, Ms. TIBON. And lastly, let us hear with the CEO of PAG-IBIG, Ms. CARINA LUMAAD.
Good morning. I will be discussing to you
The benefits of being a member in the Home Development Mutual Fund, more popularly known as the PAG-IBIG Fund. PAG-IBIG Fund is a government-owned and controlled corporation under the Department of Human Settlements and Urban Development. If you are an employed individual, you are required to a mandatory contribution. Just think of this mandate as an insurance, savings, or even an investment. Here are the 4 benefits of being a PAG-IBIG Fund member. Number 1 is savings. Number 2 is end user, home financing, and affordable PAG-IBIG loan, end user, home financing, and affordable housing loan program. Number 3 is the calamity loan. Number 4 is the multipurpose loan. For savings and contributions, guaranteed a tax-exempted annual dividends. At the end of your membership, you can be refunded of your TAV or the total accumulated value. The sum of your contributions and dividends will have much grown and even with an investment. For number 2, end user, home financing, and affordable housing loan program. This loan is available to all active members with a low income bracket with at least 24 monthly contributions, not more than 65 years old, with a gross monthly income of 17,500 and below if you are employed in the NCR, and 14,000 if you are living in other regions. You can borrow up to 6 million with an interest rate of 5.5% per annum, payable up to 30 years subject to qualifying conditions. For number 3, calamity loan. If you live in an area declared to be under in a state of calamity, you can apply for a loan for at least 80% of your TAV or the total accumulated value with an interest rate of 5.95%. You must be an active member with at least 24 monthly contributions. You can start payment 3 months after. You can apply for a calamity loan 90 days that your area is in a state of calamity. For number 4, the multipurpose loan. This is a short-term loan, and can be used for things like funding a small business, travel, or even bills payment, and even home renovation. This is also, you can apply for at least 80% of your TAV or the total accumulated value or the TAV with 10.75% per annum. You must also be an active member without any default in your PAG-IBIG loan. Thank you, and that's all.
Thank you for your presence, Ms. LUMAAD. Wow! We have so much learning received from our respective speakers. So let us hear ask Mr. Dino for any additional questions from our dear speakers.
I am so grateful because I am very much enlightened by those answers. Somehow, it will help also others who are watching, who are in the same situation too. Thank you so much and have a great day.
To our dear speakers, we thank you for your time, enlightenment, insights, especially towards the availment of benefits, services, and others related. With this knowledge, it will not be difficult for everybody. Lastly, we will see you next week stay tuned. Thank you. Bye.
Ay, nagsaba ha? Quiet on the set! Scene 3, take 1. Take 2 training. Action!